Hey there, Foster Fierce Nation. I'm your host, Amira Therese, and I owe you an apology. I have been MIA for the last week and a half. I haven't dropped a single episode, and I am so sorry for that. But I would like to explain myself. For the last 22 years after aging out of foster care, I have not been showing up for myself medically. When you're in foster care, you're not just gaslit by your parents and your foster parents, but the entire system and medical professionals. In the 90s, we were practically test subjects. It wasn't until then that they started studying children's brains. So, yes, I was a guinea pig for drugs, medical attention, and the system itself. Recently, a doctor asked me if I had been in foster care and did I age out. That question stunned me. I was like, is she psychic? Is she listening to my podcast? But it turns out she's just a great doctor. When I answered yes, she was not surprised. She seemed more aggravated at the broken system that I grew up in. She immediately ordered a full neurological workup and a cardio workup after hearing about the excruciating and chronic pain I've been dealing with since I was 16 years old. I even apologetically mentioned that it might be all in my head, since a medical professional once told me that I was psychosomatically activating pain due to past traumas that I refuse to let go of. Because if the onus isn't on me, they have to do their jobs right. The x-rays of my spine returned really disheartening results. Degenerative disc loss, almost no spacing between some of my discs, anterior bridging, bone spurs, spondylosis, scoliosis, and probably another osis and something else I can't yet pronounce. Basically, my claims from 16 onward were validated, but too late. At this point, it's gone too far. What could have been managed with non-invasive therapies is now a permanent disability. They have surgeries scheduled, yet I will forever deal with the medical neglect. I am here today to implore medical professionals to be as good as my current doctor, intuitive, insightful, and proactive. A standard line of questioning should be, were you in foster care? Did you age out? You cannot judge a foster child's body by the date of their birth. I remember countless times I told foster parents, nurses, school nurses, and doctors, anybody who would listen, about my burning, searing, chronic pain, fatigue, that I was having these spells of not knowing where I was and not thinking that I was ever going to come back from this one. And it may have only been about 30 seconds, but it's about the worst fear I've ever experienced. And every time you feel the same thing, you go through the exact same thing. But their dismissal was a constant, oh, you're too young for that, or wait till you get to my age, or you're creating these problems to get attention. Really, really negligent things to say to somebody who's come out of trauma. I was even told my pain was psychological and a remnant of past traumas. No x-rays, no ultrasounds, no MRIs, just gaslighting. I left the system convinced I needed to work through past abuse to stop creating my own medical pain. So my medical issues became a hidden, humiliating burden. Nobody took into account the physical trauma, the abuse that got me into the system in the first place. In one example of this abuse, I was 13 years old. I worked at Uncle Bud's Catfish and Steakhouse, best hush puppies this side of the Mississippi. My sister and I sold mistletoe outside of stores in Arizona to get enough money to get plane tickets to go see our mom, because it doesn't matter how bad your parents are, and you always want their love. And you always want to get back to them. You always miss them. And when you have the mind of a child, everything can be better. I can make it better. I can heal my mom. So my sister and I, we worked all night putting together mistletoe, tying the little ribbons, and then all day selling them. And we got the money. at the ages of 12 and 13 to fly ourselves to Tennessee to be with our mother. Looking back, I wish I would have bought like a Nintendo or something, but that's irrelevant. My mom made me get a job as soon as I got there, the Uncle Bud's Catfish and Steakhouse, to buy my sister whatever she needed for school because she refused to take care of my sister. She said, "We need money. If she wants to go to school, you're going to have to buy her the things that she needs." My mom would take a lot of my paychecks, and I had my boss start cashing my checks and paying me in cash before I left. And I did that so that I could pocket some of the money and she wouldn't know that how much I made. Well, she ended up finding out, and that really pissed her off. She threw me down on the ground and jumped on my back. My sister had to help me crawl into the bathroom in a daze to escape the monster on the other side. And we stayed locked in there until she calmed down, because that was the pattern of things. She would calm down. And then, out of embarrassment or gaslighting, she would kick us out. She would make us the reason for the problem. And that's what happened shortly after. This is one moment of my life, and I went through excruciating abuse. Now, I don't mean to say these things to trigger anybody or to make this too emotional. I am trying to express that our pain isn't for attention. It's real. We're often born into abusive families, substance abuse. We need real medical care to build the futures you say we deserve. If this system is really out to protect children, then why isn't our medical health a priority? Why aren't we getting full workups, full neurological, full medical, X-rays, MRIs, ultrasounds? We have things going on, and you should just assume that it's physical trauma, that what we are saying is correct. If it is in our heads, let it come down to that after you have checked off every single box. To my foster siblings, don't end up where I am today. I have heart murmurs, a back that now needs multiple surgeries, things neglected in foster care. We can't wait for the system to change. Validate yourself, stay strong, and don't let anybody tell you that what you feel isn't real. Even if it is in our heads, finding that cause should still be a priority. I want to prevent others from facing what I'm going through right now. I mean, check out my new apparatus, and don't worry, it's not that kind of a show. This is something that at my age, I shouldn't be wearing. And this is just the beginning, okay? This is just the monitor to find out why I have the heart murmurs. This is serious now, and it didn't have to be what it is today. This is why I call it the foster care experiment. There is no reason for this level of neglect. Imagine being told for 20 years that everything that is hurting you, your chronic pain, your very valid issues are all in your head, and you are creating them because you refuse to let go of the past. That's going to take a few therapy sessions on its own. I shut down after seeing my x-rays, after being told that I'm going to need surgeries, because my heart, my brain, and my body have been neglected. It's going to take us a while to change the system. So right now, my foster siblings out there, I'm telling you, do not put yourself on the back burner. Do not put your medical needs aside. Pay attention to them now, or they will affect your future, and they might already be. I am telling you right now, as your big sister foster alum, stand up for yourself and stand strong. And if you need advice, you need to reach out to me. Reach out to me. We need to empower each other because it's going to take a while to change this broken system. A system that doesn't even think it needs to change. I see the fluff pieces out there. I see the stories of success. You know what I don't see? My story. I see the stories that the system puts out, not the stories that the people who have to endure it put out. And remember, we are not a fostered individual. We are a foster nation, a foster army. and we are Foster Fierce.